We have an update tonight on last week's story about the new guidelines for cholesterol and who should take statins to reduce the risk of heart disease. The guidelines were put out by the American Heart Association and the American College of Cardiology, but tonight there are questions about the formula or the calculator that they used. So we asked Dr. Jon LaPook to look into this.
The calculator in question estimates the 10-year risk of a heart attack or stroke. It uses sex, age, race, cholesterol level, blood pressure, and whether the person smokes or has diabetes. The advisory panel said patients may benefit from statins if the risk is at least 7.5%. Two researchers, Dr. Paul Ritger and Nancy Cook of Brigham and Women's Hospital, looked at published studies of patients with cardiovascular disease and say the new calculator significantly overestimates the risk. In a draft of their commentary to be published tomorrow, they warn the calculator may suggest statin treatment for about twice as many middle-aged Americans as actually may significantly benefit from it. Dr. Neil Stone, who led the panel that devised the calculator, argues it is just one tool to help figure out who should get a statin.
When people say they're treating more people with statins, I would argue our intent was to treat more people appropriately. Isn't that what you want when you sit down with your doctor? Don't you want them to tailor-make the message to you?
Dr. Steve Nissen of the Cleveland Clinic says the calculator should have been tested more thoroughly before being released.
The right thing to do is to pull back on releasing these guidelines, put this out for public comment, let independent scientists examine the risk calculator, because we're talking about the treatment of tens of millions of Americans with medications. We have to get this right to maintain the public support.
A main goal of the panel was to decrease attention paid to a single number, cholesterol, and consider the entire patient. Now there's controversy over another number, cardiovascular risk, which was meant to simplify things.
Doctor, thanks very much.